Hey, Alphanurses, I'm Licensure from alphanurseguy.com. This is 30 practice NCLEX questions. Without the way, let's get started.
A multigravida client at 32 weeks gestation has experienced hemolytic disease of the newborn in a previous pregnancy. The nurse should prepare the client for frequent antibody titer evaluations obtained from which of the following? 1. Placental blood. 2. Amniotic fluid. 3. Fetal blood. 4. Maternal blood. The correct answer is 4. For the Rh-negative client who may be pregnant with an Rh-positive fetus, an indirect Coombs test measures antibodies in the maternal blood. Titers should be performed monthly during the first and second trimesters, and biweekly during the third trimester and the week before the due date. A client in the triage area who is at 19 weeks gestation states that she has not felt her baby move in the past week, and no fetal heart tones are found. While evaluating this client, the nurse identifies her as being at the highest risk for developing which problem? 1. Abruptio placentae. 2. Placenta previa. 3. Disseminated intravascular coagulation. 4. Threatened abortion. The correct answer is 3. A fetus that has died and is retained in utero places the mother at risk for disseminated intravascular coagulation because the clotting factors within the maternal system are consumed when a non-viable fetus is retained. The longer the fetus is retained in utero, the greater the risk of DIC. This client has no risk factors, history, or signs and symptoms that put her at risk for either abruptio placentae or placenta previa, such as sharp pain and woody, firm consistency of the abdomen, or painless bright red vaginal bleeding. There is no evidence that she is threatening to abort as she has no cramping or vaginal bleeding. On entering the room of a client who has undergone a dilatation and curettage for spontaneous abortion, the nurse finds the client crying. Which of the following comments by the nurse would be most appropriate? 1. Are you having a great deal of uterine pain? 2. Commonly spontaneous abortion means a defective embryo. 3. I'm truly sorry you lost your baby. 4. You should try to get pregnant again as soon as possible. The correct answer is 3. The death of a fetus at any time during pregnancy is a tragedy for most parents. After a spontaneous abortion, the client and family members can be expected to suffer from grief for several months or longer. When offering support, a simple statement such as, "I'm truly sorry you lost your baby," is most appropriate. Therapeutic communication techniques help the client and family understand the meaning of the loss, move less stressfully through the grief process, and share feelings. Asking the client whether she is experiencing a great deal of uterine pain is inappropriate because this is a yes or no question and doesn't allow the client to express her feelings. Saying that the embryo was defective is inappropriate because this may lead the client to think that she contributed to the fetus's demise. This is not the appropriate time to discuss embryonic or fetal malformations. However, the nurse should explain to the client that this situation was not her fault. Telling the client that she should get pregnant again as soon as possible is not therapeutic and discounts the feelings of the expectant mother who had already begun to bond with the fetus. In a pre-discharge program to educate clients with bipolar disorder and their family members, the nurse emphasizes that the most significant indicators for the onset of relapse include which of the following symptoms? 1. A sense of pleasure and motivation for new endeavors. 2. Decreased need for sleep and racing thoughts. 3. Self-concern about increase in energy. 4. Leaving a good job to start a new business. The correct answer is 2. Decreased need for sleep and racing thoughts are the most prominent hallmarks of mania. Feelings of pleasure, motivation, and increased energy within reason are desired experiences. Also, leaving a job to start a new business is not, in itself, a sign of impending illness. The client with acute mania has been admitted to the inpatient unit voluntarily. The nurse approaches the client with medication to be taken orally as prescribed by the primary health care provider. The client states, "I don't need that stuff," which responds by the nurse is best. 1. You can't refuse to take this medication. 2. If you don't take it orally, I'll give you a shot. 3. The medication will help you feel calmer. 4. I'll get you some written information about the medication. The correct answer is 3. The nurse should first attempt a collaborative approach to increasing adherence to prescribed medication regimen. Giving written medication information to a client with acute mania is poor nursing judgment, because a client with acute mania cannot benefit from written information as a result of impaired ability to focus and concentrate. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client with chronic heart failure has atrial fibrillation and a left ventricular ejection fraction of 15%. The client is taking warfarin, Coumadin. The expected outcome of this drug is to 1. Decrease circulatory overload. 2. Improve the myocardial workload. 3. Prevent thrombus formation. 4. Regulate cardiac rhythm. The correct answer is 3. Coumadin is an anticoagulant, which is used in the treatment of atrial fibrillation and decreased left ventricular ejection fraction, less than 20%, to prevent thrombus formation and release of emboli into the circulation. The client may also take other medication as needed to manage the heart failure. Coumadin does not reduce circulatory load or improve myocardial workload. Coumadin does not affect cardiac rhythm. A client is receiving streptomycin for the treatment of tuberculosis. The nurse should assess the client for 8th cranial nerve damage by observing the client for 1. Vertigo. 2. Facial paralysis. 3. Impaired vision. 4. Difficulty swallowing. The correct answer is 1. The 8th cranial nerve is a vestibulocochlear nerve, which is responsible for hearing and equilibrium. Streptomycin can damage this nerve by ototoxicity. Symptoms of ototoxicity include vertigo, tinnitus, hearing loss, and ataxia. Facial paralysis would result from damage to the facial nerve. Impaired vision would result from damage to the optic, oculomotor, or the trochlear nerves. Difficulty swallowing would result from damage to the glossopharyngeal or the vagus nerve. A client has been perceiving her roommate's stuffed animal as her own dog at home. The nurse determines that this misperception of reality illusion is improving when the client makes which of the following statements? 1. Jan's stuffed dog looks somewhat like my dog, Trixie. 2. Jan's dog and my dog could be twins. 3. I wish Jan hadn't had my dog stuffed. 4. I guess Jan needs a dog as much as I do. The correct answer is 1. Recognition by the client that there is a difference between the stuffed animal and her live dog indicates that the client perceives the reality of the situation. Stating that the stuffed animal and the client's dog could be twins reflects the client's continued misperception of reality. Thinking that the stuffed animal and her dog are one and the same. Stating that she wishes her dog hadn't been stuffed reflects her continued misperception of reality. Stating that the roommate needs a dog as much as she does is unrelated to the client's perception or misperception of reality. Furosemide is administered intravenously to a client with heart failure. How soon after administration should the nurse begin to see evidence of the drug's desired effect? 1. 5 to 10 minutes. 2. 30 to 60 minutes. 3. 2 to 4 hours. 4. 6 to 8 hours. The correct answer is 1. After intravenous injection of furosemide, diuresis normally begins in about 5 minutes and reaches its peak within about 30 minutes. Medication effects last 2 to 4 hours. When furosemide is given intramuscularly or orally, drug action begins more slowly and lasts longer than when it is given intravenously. A client has a positive reaction to the MAN-2 test. The nurse interprets this reaction to mean that the client has 1. Active tuberculosis. 2. Had contact with Mycobacterium tuberculosis. 3. Developed a resistance to tubercle bacilli. 4. Developed passive immunity to tuberculosis. The correct answer is 2. A positive MAN-2 skin test indicates that the client has been exposed to tubercle bacilli. Exposure does not necessarily mean that active disease exists. A positive MAN-2 test does not mean that the client has developed resistance. unless involved in treatment. The client may still develop active disease at any time. Immunity to tuberculosis is not possible. Which of the following is an expected outcome of pursed lip breathing for clients with emphysema? 1. To promote oxygen intake. 2. To strengthen the diaphragm. 3. To strengthen the intercostal muscles. 4. To promote carbon dioxide elimination. The correct answer is 4. Pursed lip breathing prolongs exhalation and prevents air trapping in the alveoli, thereby promoting carbon dioxide elimination. By prolonging exhalation and helping the client relax, pursed lip breathing helps the client learn to control the rate and depth of respiration. Pursed lip breathing does not promote the intake of oxygen, strengthen the diaphragm, or strengthen intercostal muscles. An elderly client with diabetes who has been maintained on metformin glucophage has been scheduled for a cardiac catheterization. The nurse should verify that the physician has written a prescription to 1. Limit the amount of protein in the diet prior to the cardiac cath. 2. Withhold the glucophage prior to the cardiac catheterization. 3. Administer the glucophage with only a sip of water prior to the cardiac catheterization. 4. Give the glucophage before breakfast. The correct answer is 2. The nurse should verify that the physician has requested to withhold the glucophage prior to any procedure requiring dye, such as a cardiac catheterization, due to increased risk of lactic acidosis. Additionally, the drug will usually be withheld for up to 48 hours following a procedure involving dye, while it clears the client's system. The physician may prescribe sliding scale insulin during this time if needed. Regardless of how or when the medication is administered, the medication should be withheld. The amount of protein in the client's diet prior to the cardiac catheterization has no correlation with the medication or the test. When developing the discharge teaching plan for the parents of a child who has undergone a cardiac catheterization for ventricular septal defect, which of the following should the nurse expect to include? 1. Restriction of the child activities for the next 3 weeks. 2. Use of sponge baths until the stitches are removed. 3. Use of prophylactic antibiotics before receiving any dental work. 4. Maintenance of a pressure dressing until return visit with a primary healthcare provider. The correct answer is 3. Prophylactic antibiotics are suggested for children with heart defects before dental work is done to reduce the risk of bacterial infection. Typically, activities are not restricted after cardiac catheterization. A percutaneous approach is used to insert the catheter, so stitches are not necessary. Showering or bathing is allowed as usual. The pressure dressing will be removed before the child is discharged. A client uses a metered dose inhaler to aid in management of asthma, which action indicates to the nurse that the client needs further instruction regarding its use. Select all that apply. 1. Activation of the MDI is not coordinated with inspiration. 2. The client inspires rapidly when using the MDI. 3. The client holds his breath for 3 seconds after inhaling with the MDI. 4. The client shakes the MDI after use. 5. The client performs puffs in rapid succession. The correct answers are 1, 2, 3, 4, and 5. Utilization of an MDI requires coordination between activation and inspiration. Deep breaths to ensure that medication is distributed into the lungs, holding the breath for 10 seconds or as long as possible to disperse the medication into the lungs, shaking up the medication in the MDI before use, and a sufficient amount of time between puffs to provide an adequate amount of inhalation medication. For a client who excretes excessive amounts of calcium during the postoperative period after open heart surgery, which of the following measures should the nurse institute to help prevent complications associated with excessive calcium excretion? 1. Ensure a liberal fluid intake. 2. Provide an alkaline ash diet. 3. Prevent constipation. 4. Enrich the client's diet with dairy products. The correct answer is 1. In an immobilized client, calcium leaves the bone and concentrates in the extracellular fluid. When a large amount of calcium passes through the kidneys, calcium can precipitate and form calculi. Nursing interventions that help prevent calculi include ensuring a liberal fluid intake, unless contraindicated. A diet rich in acid should be provided to keep the urine acidic, which increases the solubility of calcium. Preventing constipation is not associated with excessive calcium excretion. Limiting foods rich in calcium, such as dairy products, will help in preventing renal calculi. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. As part of the preoperative teaching for the family of a child undergoing a tetralogy of phallic repair, the nurse tells the family upon returning to the pediatric floor that the child may 1. Be placed on a reduced sodium diet. 2. Have an activity restriction for several days. 3. Be assigned to an isolation room. 4. Have visits limited to a select few. The correct answer is 1. Because of the hemodynamic changes that occur with open heart surgery repair, particularly with septal defects, transient congestive heart failure may develop. Therefore, the child's sodium intake typically is restricted to 2 to 3 grams per day. Activity restrictions are inappropriate. Typically, the child is encouraged to walk the halls and unit. Risk for infection after the repair is the same as any postoperative client. Therefore, isolation is not necessary. The child may be placed in a room with other children who are not contagious. Visitors are not restricted unless the pediatric unit has restrictive visiting policies. The nurse should teach the client with asthma that which of the following is one of the most common precipitating factors of an acute asthma attack? 1. Occupational exposure to toxins. 2. Viral respiratory infections. 3. Exposure to cigarette smoke. 4. Exercising in cold temperatures. The correct answer is 2. The most common precipitator of asthma attacks is viral respiratory infection. Clients with asthma should avoid people who have the flu or a cold and should get yearly flu vaccinations. Environmental exposure to toxins or heavy particulate matter can trigger asthma attacks. However, far fewer asthmatics are exposed to such toxins than are exposed to viruses. Cigarette smoke can also trigger asthma attacks, but to a lesser extent than viral respiratory infections. Some asthmatic attacks are triggered by exercising in cold weather. The nurse is making rounds and observes a client who had a tracheostomy tube inserted 2 days ago. See figure below. The nursing policy manual recommends use of the gauze pad. The nurse should 1. Make sure the gauze pad is dry and the client is in a comfortable position. 2. Reposition the gauze pad around the stoma with the open end downward. 3. Ask a registered nurse to change the ties and position another gauze pad around the stoma. 4. Ask the nursing assistant to tie the tracheostomy tube ties in the back of the client's neck. The correct answer is 1. The tracheostomy tube, ties, and gauze pad are positioned correctly. The nurse should be sure the client is comfortable. The tracheostomy tube ties should be tied in a square knot on the side of the neck and alternate sides of the neck when the ties are changed. The full part of the gauze square should be placed under the tracheostomy tube to absorb drainage. There is no indication the ties need to be changed. An additional gauze pad is not necessary. If necessary, the current gauze square should be changed rather than add an additional pad. When teaching a multigravida client diagnosed with mild preeclampsia about nutritional needs, which of the following types of diet should the nurse discuss? 1. High residue diet. 2. Low sodium diet. 3. Regular diet. 4. High protein diet. The correct answer is 3. For clients with mild preeclampsia, a regular diet with ample protein and calories is recommended. If the client experiences constipation, she should increase the fiber in her diet, such as by eating raw fruits and vegetables, and increase fluid intake. A high residue diet is not a nutritional need in preeclampsia. Sodium and fluid intake should not be restricted or increased. A high protein diet is unnecessary. When developing a plan of care for a newly admitted 2-year-old child with a diagnosis of Kawasaki disease, Which of the following should be the priority? 1. Taking vital signs every 6 hours. 2. Monitoring intake and output every hour. 3. Minimizing skin discomfort. 4. Providing passive range of motion exercises. The correct answer is 2. Cardiac status must be monitored carefully in the initial phase of KD because the child is at high risk for congestive heart failure. Therefore, the nurse needs to assess the child frequently for signs of CHF, which would include respiratory distress, and decreased urine output. Vital signs will be obtained more often than every 6 hours because of the risk of CHF. Although minimizing skin discomfort would be important, it does not take priority over monitoring the child's hourly intake and output. Passive range of motion exercises will be done if the child develops arthritis. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following would the nurse identify as a priority to achieve when developing the plan of care for a prima gravida client at 38 weeks gestation who is hospitalized with severe preeclampsia and receiving intravenous magnesium sulfate? 1. Decrease generalized edema within 8 hours. 2. Decrease urinary output during the first 24 hours. 3. Sedation and decreased reflex excitability within 48 hours. 4. Absence of any seizure activity during the first 48 hours. The correct answer is 4. The highest priority for a client with severe preeclampsia is to prevent seizures, thereby minimizing the possibility of adverse effects on the mother and fetus, and then to facilitate safe childbirth. Efforts to decrease edema, reduce blood pressure, increase urine output, limit kidney damage, and maintain sedation are desirable but are not as important as preventing seizures. It would take several days or weeks for the edema to be decreased. Sedation and decreased reflex excitability can occur with the administration of intravenous magnesium sulfate, which peaks in 30 minutes, much sooner than 48 hours. A prima gravida client with severe preeclampsia exhibits hyperactive, very brisk patellar reflexes with 2 beats of ankle clonus present. The nurse documents the patellar reflexes as which of the following? 1, 1 plus, 2, 2 plus, 3, 3 plus, 4, 4 plus. The correct answer is 4. These findings will be documented as 4 plus. 1 plus indicates a diminished response. 2 plus indicates a normal response. 3 plus indicates a response that is brisker than average but not abnormal. Mild clonus is said to be present when there are 2 movements. An obese 36-year-old multigravida client at 12 weeks gestation has a history of chronic hypertension. She was treated with methyl-dopa before becoming pregnant. When counseling the client about diet during pregnancy, the nurse realizes that the client needs additional instruction when she states which of the following? 1. I need to reduce my caloric intake to 1,200 calories per day. 2. A regular diet is recommended during pregnancy. 3. I should eat more frequent meals if I get heartburn. 4. I need to consume more fluids and fiber each day. The correct answer is 1. Pregnancy is not the time for clients to begin a diet. Clients with chronic hypertension need to consume adequate calories to support fetal growth and development. They also need an adequate protein intake. Meat and beans are good sources of protein. Most pregnant women report that eating more frequent, smaller meals decreases heartburn resulting from the reflux of acidic secretions into the lower esophagus. Pregnant women need adequate hydration and fiber to prevent constipation. The nurse is caring for a 22-year-old G2, P2 client who has disseminated intravascular coagulation after delivering a dead fetus. Which finding is the highest priority to report to the healthcare provider? 1. Activated partial thromboplastin time of 30 seconds. 2. Hemoglobin of 11.5 grams per deciliter. 3. Urinary output of 25 milliliters in the past hour. 4. Platelets at 149,000. The correct answer is 3. Urinary output of less than 30 milliliters per hour indicates renal compromise and would be the most important assessment finding to report to the healthcare provider. The APTT is within normal limits, and the hemoglobin is lower than value for an adult female, but within normal limits for a pregnant female. Although the platelet level is slightly low and may impact blood clotting when compared to renal failure, it is less important. Following a cesarean birth for abruptio placentae, a multigravida client tells a nurse, "I feel like such a failure. None of my other childbirths were like this." The nurse's response to the client is based on the understanding of which of the following? 1. The client will most likely have postpartum blues. 2. Maternal-infant bonding is likely to be difficult. 3. The client's feeling of grief is a normal reaction. 4. This type of birth was necessary to save the client's life. The correct answer is 3. Feelings of loss, grief, and guilt are normal after cesarean birth, particularly if it was not planned. The nurse should support the client, listen with empathy, and allow the client time to grieve. The likelihood of the client experiencing postpartum blues is not known, and no evidence is presented. Although maternal-infant bonding may be delayed owing to neonatal complications or maternal pain and subsequent medications, it should not be difficult. Although the nurse is aware that this type of birth was necessary to save the client's life, using this as the basis for the response does not acknowledge the mother's feelings. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A client who is neatly dressed and clutching a leather briefcase tightly in his arms scans the adult inpatient unit on his arrival at the hospital and backs away from the window. The client requests that the nurse move away from the window. The nurse recognizes that doing as the client requested is contraindicated for which of the following reasons? 1. The action will make the client feel that the nurse is humoring him. 2. The action indicates nonverbal agreement with the client's false ideas. 3. The client will then think that he will have his way when he wishes. 4. The nurse will be demonstrating a lack of composure over the situation. The correct answer is 2. The nurse's nonverbal behavior, moving away from the window as the client requests, indicates agreement with the client's false ideas. The client's behavior is likely to be reinforced if the nurse takes steps to agree with the false ideas the client holds. The parents of a 20-year-old female client diagnosed with paranoid schizophrenia admitted 4 days ago are attending a family psychoeducation group in the hospital. Which of the following statements by the mother indicates that she understands her daughter's illness and management? 1. I know that I'll have to do everything for my daughter when she comes home. 2. Tasks as simple as getting out of bed and showering in the morning may be difficult for her. 3. I know that visits from her friends at home should be discouraged for a while. 4. She won't experience a relapse as long as she takes her prescribed medication. The correct answer is 2. Clients with paranoid schizophrenia experience alterations in thought resulting in introspection, confusion, and distraction from external reality. Simple tasks that require concentration and effort, including activities involving self-care, may be difficult for the client, especially during the acute phase of the illness. However, the mother should not need to do everything for her daughter. Rather, the mother should encourage the daughter to do things for herself with guidance. Visits from friends should be discussed with the client, and the client should be encouraged to visit with friends to minimize the risk of social isolation. Although relapse typically occurs with medication noncompliance, vulnerability to stress, a low threshold for stress, the number of stresses, and the client's lack of adaptive coping behaviors contribute to relapse. When developing the plan of care for a client who is staying in his room because he perceives that staff want to harm him, which of the following outcomes of care planning is most realistic? 1. Within 2 days, the client will complete activities of daily living. 2. Within 3 days, the client will participate in recreation with other clients. 3. Within 4 days, the client will demonstrate an absence of verbal aggression. 4. Within 5 days, the client will seek out staff to talk about feelings. The correct answer is 4. The client is exhibiting suspiciousness of and a lack of trust in the staff, not aggression. Seeking out staff indicates the development of trust and decreased suspiciousness. Although completing activities of daily living and participating in recreation with other clients are important, the major problem presented is related to the client's isolation and perception of being harmed, not, for example, showering, hygiene, or other clients. A client is sitting in the corner of the day room cocking his head to one side as if he hears something, but no one is nearby. The nurse suspects he is having auditory hallucinations. Which of the following questions should the nurse ask first? 1. Are you seeing someone other than me? 2. What are you hearing right now? 3. What is going on with you right now? 4. Do you want to go to the recreation room? The correct answer is 2. Before intervening with the client experiencing hallucinations, the nurse must validate what the client is experiencing. Asking the client what he hears right now accomplishes this. Asking about seeing someone near the client would be appropriate to validate visual hallucinations. Asking the client about what is going on may be helpful. However, the question is too general to validate that the client is experiencing auditory hallucinations. Asking the client if he wants to go to the recreation room might be appropriate after the nurse has validated what the client is experiencing. A client is being successfully treated with clozapine. Which of the following statements by the client reflects a need for further teaching about managing the drug's adverse effects? 1. If I eat too many fruits, I'll get constipated. 2. I need to take the medicine with food to avoid nausea. 3. I have to get up slowly so I don't get dizzy. 4. Sometimes I have to push myself because I'm sleepy. The correct answer is 1. Clozapine is the one atypical antipsychotic associated with severe anticholinergic adverse effects, such as constipation. Consuming fruits would not be the cause of the client's constipation. The client should take clozapine with food to avoid nausea. Getting up slowly indicates that the client understands that postural hypotension may occur with clozapine. The statement about sleepiness indicates that the client understands that sedation may occur with this drug. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.